Hey everyone, welcome back to Clinical Physio. I'm Khalid Maidan and today we're going to be discussing a condition that affects so many people around the world, which is gout. In this video, I'm going to be taking you through what gout is and some of the causes that lead to it, followed by some of the signs and symptoms that we need to know for diagnosis, followed by what we need to do in order to help our patients that come into our physiotherapy clinic presenting with signs of gout. So let's get into it, let's get clinical. So gout is a form of inflammatory arthritis, which is caused when we have too much uric acid in our system. When our body struggles to break down uric acid, it leads to urate crystals being formed and being deposited in joints around our body. When that happens, those crystals lead to inflammation of the joint, which, if not treated over time, can eventually lead to tissue damage. So what factors lead to these high urate levels? Well, the first thing is no doubt to do with our diet, and a diet which is rich in meat, seafood and alcohol can absolutely lead to high urate levels. It is because of this diet that gout used to be called, and is still sometimes referred to, as the disease of kings, because of course it's a diet that kings would have eaten. Other risk factors include being male, having high levels of triglycerides or fat in the blood, being overweight, medications such as diuretics, and other conditions such as psoriasis and diabetes can also be risk factors for gout. So the classic signs and symptoms of gout include redness, swelling, and clear pain over a certain joint. And it tends to be that the joint is really tender to touch, even with light pressure. We know that when a patient has gout, the levels of inflammation peak at about 24 hours after onset. Now, which joints does gout affect? Well, we know that 50% of all attacks of gout and 70% of the first episode of gout tends to affect the first MTPJ, or the first toe in the foot. But other joints that can be affected include the knee, the elbow, and the wrist. And naturally, depending on which joint is affected for your patient, they might have problems with movement of that joint, and certainly if it's the big toe, it's going to be really painful to walk on. So if you're a physiotherapist and you see some of these signs and symptoms in your patient which you think might be due to gout, we absolutely suggest that you refer the patient to see a doctor as soon as possible. What will the doctor do? Well, it might be that they examine the patient and of course take a history. They may also aspirate some of the fluid from the joint that's affected to see what's in it and to see about those uric acid levels. And they may even order an X-ray to see whether or not the patient has a fracture for differential diagnosis, but also to potentially see if there has been high levels of bony erosion, which can happen if gout is left untreated for a long period of time. So once again, as a physiotherapist, it's really important that we take time to listen to the patient's history, and don't be afraid to ask them about their diet to see if you can find some of those dietary aspects that may lead to high uric acid levels. Make sure that you examine the patient fully, palpating the different joints to see if they're swollen or painful, and then have a think about the diagnosis of gout alongside other differential diagnoses such as a fracture, which could be the case if the patient's had a trauma, or different rheumatological conditions such as rheumatoid arthritis. Of course, it goes without saying, if you're not sure with your patient in front of you, then get a senior colleague to check it out with you, and if not, refer the patient on to see a doctor so they can be examined fully. So guys, if you've enjoyed this video, please be sure to hit that like button and subscribe to our channel for more information. Otherwise, my name's Khalid Maidan. It's been a pleasure to speak to you today, and we'll see you really soon, right here on Clinical Physio.